September 14, 2017. People with chronic kidney disease may be especially vulnerable to the deleterious effects of poor sleep, according to a new paper published in the Journal of the American Society of Nephrology. Chronic kidney disease is characterized by gradual loss of kidney function over time, and may eventually lead to kidney failure, leading patients to undergo dialysis or a kidney transplant. Chronic kidney disease can be caused by diabetes, high blood pressure and other disorders. Early detection and treatment can often keep chronic kidney disease from getting worse. Poor sleep is known to be associated with worse cardiac function, higher levels of inflammation, insulin resistance and poor hormonal regulation of the appetite. Previous studies have suggested that poor sleep is common among patients with chronic kidney disease, but few studies have looked at the effects of sleep on the progression of the disease. A research study led by Dr. Anna Ricardo, Associate Professor of Medicine in the University of Illinois Chicago College of Medicine, and Kristen Knutson, Associate Professor of Neurology and Preventive Medicine at Northwestern University, examined the association between sleep duration and quality on progression of chronic kidney disease among 431 patients with chronic kidney disease. Participants had a mean age of 60 years old. 48% were women, and half of the participants also had diabetes. Participants were asked to wear an accelerometer on the wrists for 5 to 7 days. The devices measure motion and provide information on duration of sleep as well as periods of wakefulness. Patients also kept a sleep journal where they logged hours slept. Participants were followed up for 5 years. We observed that sleep is seriously impaired in these patients with chronic kidney disease, said Ricardo. The average hours of sleep among the participants was 6.5 hours per night. On average, participants spent 21% of the time in bed in wakeful periods. Interrupted sleep, also known as sleep fragmentation, was associated with a slightly elevated risk of developing kidney failure. Over the 5-year follow-up, 70 participants developed kidney failure, and 48 participants died. Higher sleep fragmentation and shorter sleep duration were each associated with steeper declines in kidney function over time. Each hour less of sleep duration increases the risk for deterioration of kidney function over time, Ricardo said. Additionally, self-reported daytime sleepiness was associated with an 11% increased risk of death from any cause. Patients with chronic kidney disease often have co-occurring hypertension, obesity and diabetes. Ricardo suspects that many may also have underlying sleep apnea, which may be the main cause of the poor sleep reported by so many patients with chronic kidney disease. We hope to measure the effect of sleep apnea among patients with chronic kidney disease in follow-up studies, said Ricardo. Her team did not assess for sleep apnea among participants of the current study, but Ricardo said many patients with chronic kidney disease are likely to have sleep apnea because they share similar risk factors, including obesity, hypertension, and diabetes. If we find that sleep apnea is a main driver of poor sleep among patients with chronic kidney disease, then perhaps ensuring that it is treated can help improve overall outcomes, she said. End co-authors on the paper drive: James Lash, Janet Cohan, Eunice Carmona Powell, and Jinsong Chen, of the University of Illinois Chicago. Nicholas Turek and Eve Concorta, University of Chicago Drive. Lawrence Apple, Johns Hopkins University. Dr. Lydia Balzano, Tulane University. Dr. Manjula Kuralatamura, Stanford University School of Medicine. Dr. Susan Steigerwald, University of Michigan Drive. John Darrell Thornton and Dr. Mehaboob Rahman, Case Western Reserve University, and Dr. Matthew Ware, University of Maryland. Funding from the CRIC study was obtained in part under a cooperative agreement from National Institute of Diabetes and Digestive and Kidney Diseases U01DK060990, U01DK060984, U01DK061022, U01DK061021, U01DK061028, U01DK060980, U01DK060963, and U01DK060902. University of Illinois at Chicago. Related diabetes articles: A Better Way to Predict Diabetes. An international team of researchers has discovered a simple, accurate new way to predict which women with gestational diabetes will develop type 2 diabetes after delivery. New cause of diabetes. Although insulin-producing cells are found in the endocrine tissue of the pancreas, a new mouse study suggests that abnormalities in the exocrine tissue could cause cell non-autonomous effects that promotes diabetes-like symptoms. Current diabetes news and events. We have handpicked the best science podcasts for 2017. Sit back and enjoy new science podcasts updated daily from your favorite science news services and scientists. Now playing Radiolab presents Anna in Somalia. This week we are presenting a story from NPR foreign correspondent Gregory Warner and his new globe-trotting podcast Rough Translation. Mohammed was having the best 6 months of his life working a job he loved, making mixtapes for his sweetheart, when the communist Somali regime purporked him out of his own home and sentenced him to a lifetime of solitary confinement, with only concrete walls and cockroaches to keep him company. Mohammed felt miserable, alone, despondent, but then one day, 18 months into his sentence, he heard a whisper that would open up a portal to, of all places and times, 19th century Russia, and that would teach him how to live and love again. Your browser does not support the audio element. Now playing TED Radio. Our future consequences. From data collection to gene editing to AI, what we once considered science fiction is now becoming reality. This hour, TED speakers explore the future consequences of our present actions. Guests include designer Anab Jain, futurist Juan Enriquez, biologist Paul Nerdfler, and neuroscientist and philosopher Sam Harris. Your browser does not support the audio element.